Welcome back, everybody, to Happy Health Hour at Vera University. With me, as usual, we have Dr. M and we have Dr. P. Hi, Dr. P and Dr. M. How are you doing?
Good.
Wonderful.
Good. Busy.
But Linda is not here. I was tempted to say, what have you done with Linda? Suspicious, in a very suspicious way. But there's nothing suspicious about it because we have her husband here, Dr. Dalton M. Benson. Hi, Dalton. How are you?
I'm good today, Dante.
So everybody on this show has a handle, Dr. P, Dr. M. Is it okay if we give you a handle? We give you the handle Dr. B, which is not very creative or innovative. It's just the beginning of your surname, but is that okay? We just go for Dr. B?
Well, that's fine. That's what pretty much everybody calls me anyway.
Okay. We're good. We're good to go. So this week, guys, we are talking about the subject of depression. And you guys are going to educate me and the audience about depression. And Dr. B, you're the new kid on the block, not in terms of medical practice. You're decades in that field, but as a podcaster, you are a new kid on the block. So Dr. P, why don't you kick us off and just please tell me what is depression? Just define it for me so I understand what depression is, please.
Well, depression is a broad term and it covers many entities. And it's generally people think about depression when you talk about feelings of sadness, feelings of self-worth, low self-worth. But there's just many kinds of depression. There's major depressions. There's postpartum depressions, all kinds of different entities, all of which are defined somewhat a little bit differently. But the basic overall guiding thing is the profound feeling of sadness and loss of interest and pleasure in things. And that kind of is a broad outline for it.
Okay. So there's not one single definition.
It's not one single entity. No, it's and as a matter of fact, and when we try to evaluate depression, we try to get down as to what the specific cause of that depression is.
Okay. You're very tantalizing of you to sort of throw us a little bit of a definition in there, but it makes me want to find out more. So maybe Dr. P, I can come to you. So, would I be right in thinking that depression and anxiety are so linked that they may as well be the same thing, depression and anxiety?
They are related, but they're not the same thing. So depression is a mood disorder. It is not a mental health comes in various shades. One is a difference of perception. You may see the world differently than I. That's one problem. You may see things that don't exist. That's another problem. You may see them differently than others. Or your mood, how you feel, is changes, and that depression comes in that kind of under that rubric and under that umbrella, and then it has various shades to it. So one is one episode, something happened, single episode. One is recurrent, it keeps coming, it's a constant thing, or it keeps coming, goes up and down, it comes in waves. You can be feeling great today, tomorrow you'll be feeling totally depressed. Or a longer wave where 3 months you can be in a very depressed state, and then you can be in a very in a so-called normal state. Then it comes in also what is called a bipolar state. Some people become very manic. They become hyper. You may hear of people spending all their income in a few hours, or all their inheritance within a few days, or doing things, not sleeping, staying up for 36 hours, having, so a lot of activity, hypermanic it's called. It's a manic state. So that's a different shade. And then anxiety is more a state of apprehension, but depression can lead to anxiety. Anxiety is not depression. It's a different way that we kind of approach the world, ourselves, and others around us. How do we feel? Depression, underlying depression, which is often we miss it. So depression can cause anxiety about the world, and if you try to cure just anxiety, you will not be able to fix it. So these are different shades to it, and it's a fairly complex and vast field, and a fascinating field. And it can also vary with other situations, of course, in the physiology of the person. Sometimes the thyroid is not functioning properly, or there are other clinical conditions that can affect it. And conversely, depression can lead to physical ailments, and sometimes that's how it may manifest, called psychosomatic conditions, or it can really lead to significant problems. Often it may be associated with PTSD, post-traumatic stress disorder, and very common, far more common than we realize. So let me stop here and let it pass it back to you.
Again, very, very, very tantalizing. Now, I'm going to come back to some of these things, but Dr. M, the question I always want to ask you, because of the work you do, the very precise work you do, is what are the causes of depression? You are so skilled in diagnosis and understanding cause, very contextually. So talk to us about some of the causes of depression.
Well, before I get into the dark subject, I wanted to show you this little guy. Can you read that?
You make me so happy.
So you see that MISO?
Miso.
Yes. That is a very important piece of information here. Miso.
Okay.
This is this is one of the things that I would be putting into someone's program who is having depression, for reasons I'll enter into in just a minute. But causes of depression, you're talking about anything from a disbiosis, which means the whole microbiome, the gut bacteria, the body's bacteria, and other organisms are all out of whack. And why does that happen? Well, going back to the things that we were talking about in terms of food and obesity in our previous discussions, highly processed foods can lead to a dysbiosis, meaning throwing off the whole of the gut's nice, good bacterial environment, garden, if you will, and that can really transfer up to the brain and cause the brain to literally have low energy, low vibrations, if you will, and create almost like an atmosphere of darkness, depression. We think of depression, we think of a darkness. So when your gut is not well, your brain is not well. And if that happens and it keeps happening, that you're in the habit of feeding your body poorly, that can be a big contributor to a depressed mood. Hormonal changes can lead to depression if someone is low in certain hormones, i.e. your testosterone or even estrogen. There are different hormones that we have in the body. Your cortisol level, your dopamine level, your melatonin levels. These are all hormones. If they're low for various reasons of being upset by some environmental, whether it's food, whether it's you're not getting enough sunlight, whether it's you're being exposed to chemicals that can also lead to depression. So pathways in the body that would normally be uplifting you or keeping you intact and mentally balanced can be upset by environmental things. And food is one of the biggest upsets, especially when the food is not good for you. The miso soup is a fermented food. It's a cultured food. It's a soup. It's actually originating in Japan. And it's a wonderful soup for restoring the gut to good health. So when somebody gave this to me, they were right on.
Yeah, amazing. what about emotions? Before I come back to Dr. B, what about emotions? Can emotions cause, depression too? You talk
Yeah,
about,
and if you're in your circumstances, certainly, if there's been a major turnover in your life, whether it's you've lost someone precious to you, or something. I mean, one can lose their home, their livelihood, trauma. All of these other things are absolutely contributors, factors, things that can lead to a person totally going in and making a downturn in their mental state, their mood, as Dr. P said, their mood becomes really, really low. And that leads to a whole cascade of other things that go on in the body. It's very complicated. I mean, we cannot we're just scratching the surface right now. We can't even get to all of the chemistry and the physiology, all of the things that change when people go through these changes in their bodies, whether they're emotional or they're physical, or there's some, other environmental, some toxins that have gotten into the body. That upset is going to cause a cascade of a lot of different biochemical disturbances. And so you can have, oh yes, all kinds of manifestations. So as Dr. B said before, there's a postpartum depression. So that's unfortunately something that happens to a lot of women. Again, that would be for a woman only, where her whole mood changes and she actually becomes almost despondent and not responsive to her own baby. So that is a very serious problem. And again, it's an imbalance. There's something wrong, whether it's something she's been exposed to, emotional changes. There can be so many factors, and it's usually something environmental.
Look, Dr. M, you said we're scratching the surface, and obviously we're scratching the surface. Between you have decades of experience in medical practice. But I and all our listeners and viewers, I've learned so much, and so has everybody else. So in these 12 minutes, so thank you for just making, as you always do, making this just so relatable and easy to explain. Thank you so much, Dr. B. Coming back to you, how do you diagnose depression? No, let me say it in a different way. Can you, with all that experience, can you see if somebody's depressed? If they walk into your surgery and they're talking about something else, can you see and understand and observe that they're depressed? How good are you at just observing they're depressed without somebody saying, "Doc, I'm depressed, I need some pill"?
It takes a lot of experience, but the patient will give you clues as to how depressed or not depressed. When they start talking about being irritable, when they're not making eye contact, when they've been losing weight, when they're not sleeping at night, um, they may be agitated in the way they're sitting there. You can feel the energy after I've been in practice for 48 years, and I can feel that nervous, depressed energy when somebody walks into the office with me. And it's not it's not a cut and dried thing, because different people will present different ways. And so as you're trying to evaluate them, you're trying to say, well, is this something that would be normal for this patient, or is this something that goes different? The more you know the patient, the easier it is to make the diagnosis when they become depressed. Sometimes they will come in and tell you they're depressed. A great many of them will come in denying depression, because depression carries a stigma with it, and people don't like to admit that they're depressed or that life is getting them down. And the different situations, as Dr. P and Dr. M were talking about, situational adjustments can lead to depression. And then there's grief, which is not depression, but mimics depression. But normal grief you can get over and work your way through over the course of several months, and you don't have to rush in and treat normal grief. You just have to learn to work with it, people going through a grieving process. Now, if it goes long, real long, then it becomes unresolved grief, and that is a form of depression. So as you're looking at and seeing the patients, they kind of will tell you where they are without telling you. But it's sometimes very subtle clues. And so let me kick this back, but I think that's the chief answer to your question, Natish. It's
So I'm going to ask you another question. Super quick question. So could a 30-year-old doctor be skilled enough to spot depression as well as a, say, 55, 60-year-old doctor?
the answer is yes, if they've seen a lot of it. It depends on the populations they've worked with. I've seen 30-year-old doctors who were extremely good at evaluating people for depression. And you have to have a certain, these are doctors also that I would say have a lot of empathy. And that's when you can feel the depression. And some of them are very skilled at doing it. However, I would say the more experience you have having seen patient after patient come into your office for years, the easier it is to make that evaluation and approach. Are you depressed? Can we talk about depression? How are you feeling? How's this changing or manifesting in your life? Those kinds of things. So yeah, but a 30-year-old needs to who has the experience of having seen a lot, then they learn very quickly.
Yeah. Thank you, Dr. B. Dr. P, I've learned over the series of the work we've done here in these episodes and beyond, you're a great student of politics, of history, of comparative politics, of geography, of time, of space, of regions. Is depression something, in your opinion, that's become more widespread or less widespread? And what are the causes and reasons of our societies being more or less depressed than they were a few hundred or 1,000 or 5,000 years ago? To give us a really good helicopter view about how, terrible word coming up, how normal it has been through human societies and human evolution to be depressed or not depressed.
See, we are in the best of times and in the worst of times, to paraphrase
I see you
Charles.
read, maybe, was it Voltaire? Maybe you've read some
Charles
Voltaire.
Dickens, that A Tale of Two Cities.
Tale of Two Cities, I'm sorry. Yeah.
Right. So we never before in the history of mankind have we been given greater opportunity to create anew. Never before have we been given the opportunity to destroy anew. Never have we been given opportunities to access enjoyment, pleasure, knowledge, communication. These are amazing gifts that we have today. But the darker side to it is, one, it has created this expectation and confusion between joy and pleasure. It has taken away human productivity, and it has taken away the joy and the pride of physical activity. And so remember this, I don't know if there was an essay I read a long time ago, 7 Habits of Happiness. 7 habits. And these are very simple, basic things. And we start with food, sleep, exercise, being able to do creative and productive work. How many of us are creative right now? Being able to have a good relationship with people around you, the ability to have friends. We live longer, we have more technology, but the intensity of life is greater, possibly, but is even less in some ways because we have been turned into automatons. We are on the smartphones. That's all we do. We flip things. And so our children's awareness is changing. It has become dependent. And of course, AI is here. But no matter how much AI is there, it will never replace the natural stupidity of mankind. And that is where the challenge is. A few years ago, if you remember, there was a book, Listening to Prozac, and it became famous. And the concept was just by manipulating the neurotransmitters in your brain with chemicals, with drugs, you could cure depression forever. It was in the 90s. And, I'm sure all of you remember that. Where is that promise? So curing depression is not just through drugs. It has a multi-dimensional reality, and human beings have more dimensions open to them today, and yet human beings have closed the first dimension that is open to them, their own inner life. And once that is gone, then you become, and maybe remember Winnie the Pooh, the simple, the cartoons. If you compare the Tigger, right, the bouncy, flouncy Tigger, bum, 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 I forget the single now. And then you have Eeyore. Right? It was a very beautiful way to, you look at Eeyore, and Eeyore is depressed, mostly, I think. There is it's just a personality.
Yeah.
But under the personality, there is a depression. So you can, but there are different kind of depression personalities, and zombie depression is also going to be there in our youth. Drugs, alcohol, chemicals, they destroy the brain and they mess up all your neurotransmitters. Also, one more thing and I'll stop. Magnetic fields and electrical fields. We treat depression with electricity, like ECT. We treat depression with magnetic fields, but we are brilliant at also causing depression with all our technical innovation. Let me throw this right back at you.
So I've got a question for Dr. M in just a moment, but I want to actually just make sure everybody who's listening, and these are recorded and they're on permanent display on our YouTube page. So hit the subscribe button. But here's what I want to say: I never ever feed the questions to the guys before to the doctors and Linda before the show. They don't know what I'm going to ask. And I will say this. Dr. P has just told me he didn't even look at he didn't even know what we were talking about till we came on the show. And the reason I want to say that is that this is not rehearsed. The guys, the doctors, Dr. M, Dr. P, Dr. B, Linda, they come on the show and they have to be authentic and ready to go. And they educate us in the course of 30, 35, 40 minutes. They educate me and you. It's brilliant free consulting. Watch them over and over again because you never have to pay. It's extraordinary. Fantastic. Thank you, guys. Dr. M, if somebody recognizes they have a tendency for depression, in I don't know, teenage years, let's say they recognize, I'm depressed in certain areas. Are there many people what a terrible way to ask that question. Can people and do people find a way to manage their depression so that they don't become depressed or they spend less time in depression?
It's a very interesting question. There are so many different ways to approach a depressed young person. Usually, the typical conventional medical world approach is this child will put him through some counseling and perhaps put this person on a drug, and that's often done. If this this young person is deemed depressed, and so you'll see that most often happening. There'll be probably some sort of counseling that goes on if someone is brought to the attention of a doctor. There are other ways, however, of approaching that, but in and of itself, like if you have a young gal who's feeling depressed or going through something she's experienced, something causes the depression. It just doesn't come out of the air.
Okay.
Albeit you have bad things in the air and they can contribute, but in the truest sense, you have generally something that's led to that person's feeling low, feeling down, and it can manifest in many ways. That person can start doing things to themselves, like a self-sabotage, say cutting oneself, or running away from home, or becoming wayward, or just lost and picked up by the police, or or just drifting, or perhaps getting in with the wrong crowd and looking for some happiness, and the happiness is is kind of twisted, and they get involved in drugs or other substances, substance abuse. So this can go in different directions. So you have the person who might be lost and not know what to do, and they can withdraw from normal activities, and it's not really recognized. And then when it is recognized, and if there's a parent or an elder who can help, then they go to some medical care. And then, like I said, they go through an analysis, and it can go one way or another. It could go to requiring counseling or some substance, which is usually what happens. They go on something on the nature of an SSRI, one of these serotonin reuptake inhibitors, very commonly given. And as was mentioned before, they get on to these drugs, and they can be on them lifelong. And if somebody's astute enough to step in, or the person himself or herself is astute enough to say, I don't want to be on this drug, then there are other ways. And I can give you a whole list of things that could be done. But, you can go on and with any further questioning, but this is a very big topic in and of itself. The young person who's depressed, how do they handle it, or how is it approached?
And Dr. B, sort of the same question, slightly different. In your experience, have you noticed in your medical experience, people recognizing in themselves that they are depressed or prone to depression, and then finding ways to work around without drugs, without any medication, to figure out how to manage their own depression? Or is this something that's not really possible?
No, I think in my practice and in my experience, there are two forms of people. There are those who are in absolute denial that they have depression, and then there are those who do recognize and amongst that they have depression. And amongst those who recognize that they have depression, you can divide that into two camps. There are some that kind of wallow in it and are looking at somebody to help pull me out of the depression. And then there are others who, and it's a fairly large subset of people who say, I don't want to be depressed. What's causing me to be depressed? Let me look at it. Am I too stressed out from life? Is it something genetic? Because depression does run in some families, and there's certainly a genetic and environmental components to many kinds of depression. So those people tend to be very assertive in terms of, I don't want to be depressed. Now, some of them will seek out help and say, help me not be depressed. And those people, in my experience, are most amenable to trying the things like the Miso soup or natural forms, talk therapy. Let's work this out. Why are you depressed? And let's work on this together. And those people tend to do well. Those people tend to do very well. The people that wallow in it, and I don't want that to be a pejorative term at all. That's not what I mean. It's just that depression has enveloped them so much that they just can't seem to get out of it in any way. Those people, we tend to, in my experience, have to do something proactive to help push them towards being on a more healthy way. both physically healthy, because physical health will lead to good mental health too, and the two are inextricably linked. And those people are the ones that you really have to determine what's the best way to help them. The others pretty much tell me how they want to be helped and how they can be helped, and I just give them the tools to do that, or at least try to give them the tools to do that.
Fantastic. Dr. P, another sort of 40,000-foot question for you, rather than in the weeds. What's a great or thoughtful diagnostic future about depression for us? What's an ideal future in terms of thoughtful care and thoughtful diagnosis for us? Where could the medical care sector get to in terms of, if we want to think about this in terms of the promised land, where could we get to in terms of diagnosis and care? What is a thoughtful future for us?
That's a sad topic. It'll make me very depressed, but let me try. See, we are no longer a society that is focused towards health. I'm just being very upfront. We have lost our focus on health, forget happiness. And so now the focus, the means are those who control the pharmaceutical industry, those who control the food industry, the ultra processed foods. With people drinking Coke when I was growing up was an exception. Now Coke is flowing in the Hudson River, and we have to find water separately, order it in bottles to get it from some strange spring that I've never heard of. See, we have lost our touch with not only with nature, with ourselves, with our families, with our friends, in every which way. We've lost that. We have been benumbed. We are broken. Our consciousness has been diffracted. Now, how do we bring a holistic approach to life? And that will only happen when your mind is no longer distracted, as Eliot said, by distractions, right? So we are men and bits of paper being blown about by the winds, right? The breeze. And so do we have the ability to withdraw from this flux and be in a place that is calm, that is ourselves, that is full of joy? And I'm not trying to bring any spirituality or theology here. I'm just talking about basic psychology. Do our children have the ability to find happiness in what they do and who they are? So the secret, the universe was created out of Ananda, according to the Taittiriya Upanishad. By Ananda, which is bliss, it is sustained, and to bliss it will return. That would be my ideal world, where we all understand that we are products. We are offsprings, children of immortality, of light, of bliss, of health. And Amritasya Putra, we are Amritasya Putraha, children of immortality, children of bliss. Until we understand that, how do we cure depression? So we have to find that secret spot within us that is true happiness. I'm going to stop there, otherwise I'll get carried away. But yoga, tai chi, meditation, walking, nature walks, going to the beach, throwing pebbles in the sea, picking up shells, talking to a friend, engaging with, looking in somebody's eyes and seeing the pain of the other person's life, and then trying to just feel empathy, talking nicely, not flipping the finger while you're driving on the road. All these are to be avoided. If we can have a society where we are compassionate, caring, we focused on health, that would be the ideal scenario.
Thank you, Dr. P. Dr. M, we're rapidly running out of time. So what is your biggest takeaway that you'd like listeners and viewers to know about depression? Biggest single takeaway that you want to leave our viewers with? Could you read it out for us again? You make miso happy. Miso soup. Everybody, I've learned something. I'm going to be drinking miso soup tomorrow now.
Yeah. This, again, it is absolutely essential that all of us, bring ourselves to some peaceful state and clean up this world, and the world about then comes along with that. So if everyone did their part and did some introspection and did some detoxification, fasting, with the help of someone else, a confidant, a loved one, a partner, anyone, a physician, someone who's in the know, who can help you. You need someone else. We need each other to help get through this, to detox the mind, body. It's all the same. It's all together. And to learn about these very basic things in life. As he said, we have to be eating, sleeping, exercising, breathing clean air, taking clean water, clean food, so forth. All of it has to be cleaned up. So once we clean up, then we'll have a different world and a very much less depressed place.
Dr. M, what a great way to end the show. Dr. B, thank you so much for appearing on this, your first episode. Is there going to be a fight at home now between you and Linda about who appears on the next show? Because if there is, we'll have you both on the show together.
I would have to say Linda would win that fight. For anybody who knows Linda. No, I thank you for having me. I enjoyed doing it and would be welcome to. I would love to come back and talk about just about any topic. Depression's a very, very important topic for everybody to kind of begin to understand. And we're only just touching a very tip of an iceberg with it, but it's a fascinating subject.
May I interrupt? And one more thing, I just wanted to get one word in edgewise.
I was going to come to you we have 1 minute and 30 seconds left, so I was going to come to you to say the final thing.
So whenever I think of depression, I think of Vincent van Gogh. That is an artist who went through so much himself and came and suffered and struggled, yet gave us some of the most beautiful creations that, the Western world has seen. But art is a very important part of healing, and ancient societies till now in multiple forms, all the 9 terpsichorees, as the Greeks called them, the 9 muses we can use, whether it's dance, whether it's poetry, whether it's sculpture, whether it's painting. Arts are a very creative and beautiful way to come to touch with ourselves. This is something that we can all collectively help and allow that creativity to come out of us through that pain and have that transformation happen. I'll stop there. Otherwise, art itself is a huge topic. But thank you. And, one thing I will say is Dalton himself, personally, not just as a physician, has seen it and experienced it. So it's quite remarkable. And you see, it's quite impressive how he has pulled himself by the socks and made of himself what he is today. So it's something to be proud of.
Thank you, Dr. P, for those nice words about, finishing positively, and your nice words about Dalton. Thank you, Dr. M. Thank you, Dr. B. Our regards to Linda. Our love to Linda. And we will see all of you next week. I am Dr. Navtej Dosanjh, and this has been Happy Health Hour with Vera University. Thank you so much.